Hi, good morning. This is Anjana Joy, and I'm doing my Masters of Nursing in University of Wollongong, and I have completed my diploma and post-basic nursing in my back home, and I have 2 years of experience in orthopedic department, and I have very interest in this role because I wanted to feel different by caring personality, and I always wanted to help my friends and others, and I'm just love by this nursing professional. So in this interview, I have taken the first question. So when I'm talking about the first question, I'll remembering one incident which has happened to my first time in my nursing life. So I was newly joined staff in my hospital. So I got my 5 patient to take care of from the morning shift to morning shift, and I took over from the night shift. So she handed over about the patient all the details, but since I was new staff, I couldn't ask details because I don't know what to ask, how to ask. So I started to give the morning care to the patient. I have given one of the painkiller for one of the patient, like injection diclofenac in 100 ml of NS, like infusion. And I was not aware about that he was allergic to the injection diclofenac. And after giving the infusion, he started to show the reaction like puffiness, shortness of breathing, swelling, itching everywhere in his body. So, and he was aware about his allergic reaction. So what happened is we informed to the doctor, and I have written the incident report, and we settled the patient by giving the antihistamine, anti-allergic, and the oxygen and some couple of observation. Everything was done. Everything was settled down. So what happened is due to lack of communication between the two staff from the night shift to the morning shift, since I'm a new staff, I didn't even much ask question about the patient, and I was not aware about it. Since she was busy and she wants to go back to home after her night shift, so she didn't explain about much about the patient condition or anything. So it was a lack of communication among the team, and it was affected the patient. So when we are thinking about the patient, it should be patient oriented care. So it's all about the communication which was happened on that day. And still I remember because it was my first day in of the nurses as a nurse. So I just want to tell you, not telling, I just want to remember every day of my communication. How many years of experience if I have, it's a 5 years or 10 years in my nursing life, I should communicate properly because then only I can improve my patient care or patient oriented care. I can give to the complete care to the patient. Only thing we need to communicate specifically, accurately, and more effectively. So that's the communication skill which is improving every day. So next is the fourth question, that yeah, the situation that I identified. Of course, in my hospital in St. John's, I was in second senior of staff, and I was posted in post-op room. So we had a few patients like after the knee replacement, hip replacement, disectomy, after the surgery, we keep the patient for the observation first 24 hours. So we do have some protocols and policies that we'll give the first initial medication, kind of a painkiller, or the nutrition supplement, and antibiotic. Everything will return given to the patient, attend to get all the medication before the doctor order it, because we know that this patient, this is the surgery and this is the medication he going to have it. So I have written given all the regular medication to the patient attender, and everything was kept ready. But the thing is, I have noticed that the respective doctors couldn't write for the heparin for the DVT after the major surgery, so which will affect, or which is complicated thing is after the surgery. So I have kept everything ready to give the injection, like heparin, antibiotic, painkiller, everything is kept ready for the patient. And I just went back to the doctor that I informed, this is the injection for the heparin you just missed for the patient, which should be followed for the 5 days. Then only we can prevent the DVT, because patient would be bedridden for the few weeks, because after the knee replacement. So, and I have noticed that the patient started the swelling of the both legs, and the painful and the swelling kind of signs and symptoms after the surgery. So that if I delay that the medication in proper time, it can be more complicated. It can be turned to any other medical condition if I didn't notice, and if I didn't tell to the doctor, and if the doctor taking more time to prescribe that, it can be affected to the patient. So right after the prescribed to the respective medication, I just went back to the patient, and I given the all the painkiller, all the DVT, DVT prescription medication, which is heparin, everything. So that was the second incident which has happened, that the can't say negligence, it should be okay. We all do have some mistakes, so that the doctors got forget, and I just noticed. So that was, I identified one problem, and I have I have cleared it out. And not only that, when we work as a team in a hospital, we should help each other, we should work as a team, we should patient oriented care. So yeah, we worked as a team, so we just avoid that complication in the situation. So next is so I do have the question that when we hire this position in your facility, how does this organization provide the support the professional development? When we are joined, how can I support the professional development when I'll do this organization? That I really want to develop, and I need to support this professional. As a professional, I need to support the organization to improve the some kind of opportunity. And this is how we all want to improve the as a nurse, as a person, we need to improve the organization opportunity, and all the support I can give to the department. That's how all we want to do, by improving the communication and improving the accurate specific care to the patient oriented care. And we all should be productive for the organization, for the patient, and everything. So is there any question? If we want to improve, we need to ask communication. We need to ask more question about the current situation. We need to clarify. We need to emphasize all the situation. So as a nurse, as a caregiver, we need to improve lots of situation to be improved, and help the patient. So this is how we do, and this is about my situation, and my experience which I had through these all years. And thank you for this opportunity to improve our quality and the critical thinking of care and everything. Thank you so much.